Yes, you read the title right. Today we'll talk about why really smart and really talented doctors at times have failed the AMC Clinical Exam. And then what are the main things that you need? What are the three main things that you need to pass this exam? The first thing that we all should understand is that AMC Clinical Exam is an exam that checks that whether you have the necessary knowledge and the skills to work as a junior medical doctor in Australia. It does not check on expert or specialist level knowledge in anything. It won't ask you about the management of a complex lung cancer patient, about the new immunotherapy or targeted therapy medications and their side effects. They won't ask you about the circumferential resection margins, neoadjuvant therapy or adjuvant therapy for colorectal cancer. No, they don't. What do they ask is they ask whether you know how to deal with common presentations and common problems that you will encounter as a junior medical doctor in the country. So even if you have expert knowledge or specialist level knowledge in a certain thing, and if you don't have a very safe and reasonable approach to the common things that you'll face as a junior medical doctor, you will fail this exam. All right, so now let's move on to the three main things that you need to master to pass this exam. The first one you already talked about. You need to have a safe, reasonable, and a structured approach to the common things that you'll face as a junior medical doctor in the community or in the hospital. What is your approach to someone with chest pain? What is your approach to someone with shortness of breath? Can you prescribe and know how to prescribe medications safely? How can you break bad news? What is your approach if someone has suicidal ideation? So these common things, you need to master how to deal with them. So you need to have a safe, structured, and a reasonable approach to deal with them. So that's one. And the second one, I can't stress on this enough. Most importantly, you need to be able to convince the examiner that you are dealing with this situation well. So how do you convince them? How will the examiner know that you're doing it well? One, he will listen to what you speak. Two, he will look at what you do. So if you're speaking, communicate very well, very clearly, very audibly, so he can listen and know that you know. And secondly, if you're doing something, if you're examining something, your actions should be very clear and precise, so the examiner would know. So first you have to know, and then you have to prove that you know to the examiner as well. How do you prove it? Speak well, and if you are examining or doing something, do it well in a way that the examiner can see or hear that you are doing it properly. Right? And the third one is a little bit of icing on the top. One is to be confident and to have a good aura. What do I mean by this? So let's say that you are approaching someone who's coming to your clinic with swelling in the elbow. You could go and say, good morning, I'm one of the doctors working in the practice. I was told that you are coming with shoulder pain, coming with elbow pain and swelling. When did this start? So you did introduce yourself, you identified the problem, and then you started gathering more information about it. The same problem you could also do. Hi, good morning. My name is Randunu. I'm one of the doctors who's working in this practice. I was informed that you are coming with swelling and pain in the elbow. Can you tell me more about it? So the second time, I was more clear, I was more confident, and had a good aura approaching the patient. So that would give you a good impression to the examiner that this is a guy who knows what he's doing, right? And of course, the aura should be, relevant and relevant to that specific clinical scenario. You can't have a very enthusiastic and a very happy aura, or very energetic going on to break bad news, or breaking bad news to a family as such. So you need to match how you speak your aura to the specific scenario. So things we talked about. How do you pass this exam? One, know the common things that you'll encounter as a junior medical doctor and have a very good approach to them. 2, communicate and act very clearly so you can convince the examiner that you know. Thirdly, be confident and have a good aura. And I know there's a lot of word around that this exam is impossible to pass, it's very difficult to pass. Yes, it is. People say it's difficult because many people fail the exam. But if you have a good approach, you can pass. I did pass it, most of my friends passed it, and we didn't have any superpowers. It was just that we were confident, we communicated well, and we know the common things that that you encounter as a junior medical doctor, and we nailed it. So I'll do more videos and I'll come back with more tips how to do it really well. But it's not impossible. It's easy, and you can do it.